health risk assessment. I can't even say HRAs, VBs, with those payments in the crosshairs, because there's the allegation that insurance companies are bribing agents with an extra $600 in payments, mainly through these, what they calling junk fees.
Yeah.
Even though you have to do work to earn the money. So yeah, it's in the crosshairs. It's being talked about at Congress. Something's brewing. Let's talk a little bit about why health risk assessments are important.
Are very important. Well, first off, we call these different things. We might call them an HRA, health risk assessment. We might call them VBEs. Basically what it is...
Value-based evaluation? What is it?
What
is it? No, it's not. I don't know what it is. They all have different acronyms.
Something based enrollment.
Enrollment?
Maybe.
Value-based?
Okay.
I don't know what it is.
Anyway, what it is, and they make a lot of sense. You don't find anything out about your client's health, right?
It's illegal.
So that's what these are. It's an opportunity to have them answer questions about their overall health so that the company can be prepared to be the best partner for them.
Right. So when you come in, you're a brand new enrollee into a Medicare Advantage plan, you are assumed to be average. So your risk score is 1. But what if you're really, really sick?
Then your risk score goes up.
So let's
which
say
means you're more expensive.
So your risk score of 2, you're going to cost the company twice as much as an average person, twice as much as what they're being reimbursed for the government for.
Versus if you might be a little bit healthier, you could come in at 0.5.
Right. You can make money. So if you're a company and you enrolled a lot of sick people.
Yeah, that's going to hurt.
Right? Because you can't
discriminate.
You can't discriminate.
Mm-hmm.
So you enrolled a lot of sick people and you're getting paid for having enrolled a lot of healthy people.
The math doesn't work.
You're not going to make money.
We got to protect our carriers to make sure that they do make money so that they stay in business.
Right. Especially your smaller carriers. This makes a big difference.
Huge difference.
Okay, so let's go into this. This is painful. This shows an average female beneficiary age 65. 75. And you can see that the more conditions you have, the higher your risk score. So the risk score over there. So that, like I said, the average person comes in, they're assumed to be a 1. This lady, if she has COPD and she has acute myocardial infarction and she has angina pectoris, if you're still watching, bless you. Just bless you for that. Then her normalized risk score is 1.149. Doesn't mean much to you. Means the whole difference.
Means dollars.
Whether these insurance companies are going to be profitable or not. So you're not worried as much about the big guys, but a lot of these little guys, you're wondering why they're always exiting. That's because they couldn't make it.
Versus our 75-year-old, she doesn't have COPD. She doesn't have
anything. She doesn't have any
this stuff or this stuff. Now she's a 0.448.
So now she's
profitable.
Yeah, she's very profitable.
So good for her.
So that's why they want to find out right away what's going on. You have a brand new enrollee. I just enrolled Rebecca, and I want to call you up and say, hey, what's your health?
Yeah.
Are you average? And she's going to go, oh, hell no.
Yeah.
I'm bad.
How much time do you have?
I'm bad. I have this, and this. So if they can give that information to the insurance company, the insurance company doesn't have to wait a whole year of treating her and then seek the money the following year. Another thing that impacts
star ratings. So if a carrier has a great year, they're a 5-star plan, they're going to get more money to invest in their plans for the following year.
So then it snowballs. So they have more money, so they can have more benefits, so they get more
beneficiaries.
So we just had a carrier get a termination letter from CMS that they are no longer eligible to sell their Medicare Advantage plans. And I think it's North Carolina and Arizona. You can Google it. I'm not going to mention them by name, but it's a big one. And that is because
they were below 3 stars
for 3 years in a row. So there's a system to knock out the players that aren't performing.
Right.
So the star ratings matter.
That's a big deal.
And that's another thing. A lot of agents think, like, who cares? Whatever the star. No. A loss of star means a loss of money, which means a loss of benefits next year, which can and does snowball.
Will have an impact. Yeah.
So how does the company,
here's the timeline.
Do it.
The whole year. So in November of the previous year, CMS is going to release early previews of the rates. Then we come down to February where they're going to publish advance notice draft letters. And then we come into April. See, you think it's over. You think once December 7th happens, you're done. No. Now we're back into April. We have a final rate notice out.
And then June is when the companies have to put in their bid for next year. So that's why it's really hard for us to get a hold of anybody because everything's crazy at the insurance companies right there.
Things are getting leaked
at the end of May, right before June. Yeah, then they filed their bids. Then we start to hear things in July, but it's not necessarily final. Then it's final in mid-September, and then we start marketing in October.
Woohoo!
There you go. Now you know how the sausage is made.
Enjoy, folks. See you soon. Subscribe.